Last year at my yearly checkup, my doctor told me I had high cholesterol. My overall cholesterol was 239 and my LDL was 160. Generally, a healthy cholesterol is no more than 200, but the lower the better. I texted my cousin, who's a nurse, the news, and she said, "That's high. Well, what are you eating? Your LDL is badly high cholesterol for your age. It shouldn't be that way." And she felt the need to re-ask the question, "What are you eating?" So I took it upon myself to give my diet a full rehaul. For 4 months, I ate nothing but skinless white chicken, fish, fruits, vegetables, and grains. I limited sugar to no more than 100 grams a day, although most days I just had none at all. I limited saturated fat to no more than 20 grams a day and kept that number as low as possible. My in-laws began trying to get me to eat little desserts here and there, claiming it was a treat. I ate 2 desserts for the entire 4 months of diet change. When I finally got back to the doctor after slaving over this very strict diet I had forced myself to adhere to, my blood was taken and the nurse called me on that fateful day to inform me that my new cholesterol was 209 and my new LDL was 75. I was a little shocked, to say the least, that my cholesterol had gone down but still wasn't under 200. It was also the skinniest I'd ever been in my life. The next time I went to the doctor to get an uncholesterol-related treatment, the nurse looked at my records and said, "Huh, that's strange. You're thin, but you have high cholesterol." For a long time, I was frustrated and confused as to why I had to summon every ounce of willpower I had to eat right, but it only led to me barely making it to the safety boundary. But then I started looking into a mental health condition that I had been diagnosed with earlier that year. Post-traumatic stress disorder, more commonly referred to as PTSD. You've probably heard of this disorder, but most of the time it's about a person who's been to war. But those people are only half the story. The other half of people who have PTSD are people like myself, who have witnessed or experienced a terrifying event or series of events that was equally as disturbing as the events occurring in war. Throughout evolution, humans have developed what scientists call a fight or flight response to events we perceive as a threat to our lives. If you're living in the wilderness and you see a tiger, the fight or flight response will force your nervous system to release stress hormones such as adrenaline and cortisol. Your heart rate quickens, your pupils dilate, your airways open up, and you're ready to either fight the tiger or run away from the tiger. But what happens when evolution has come to the point where the tiger comes home every night, and that system is activated over and over and over again? Soon the same system which evolved to be adaptive has now become maladaptive and health damaging. Children are especially sensitive to this because they're still developing. There is a way to determine how severely your PTSD will affect your health well into adulthood. There was a study done by Dr. Vince Felitti at Kaiser and Dr. Bob Conda at the CDC called the Adverse Childhood Experiences Study. It gives us a measurement and classification of adverse childhood experiences, or ACEs. These include physical abuse, emotional abuse, sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, or incarceration, parental separation, and domestic violence. Dr. Conda and Dr. Felitti found that there is a direct dose-response relationship between these ACEs and health outcomes. Having 4 or more ACEs makes you 2.5 times more likely to have chronic obstruction pulmonary disease, 2.5 more times likely to have hepatitis, 4.5 times more likely to have depression, and 12 times more prone to suicidality than a person with 0 ACEs. An ACE score of 7 or more triples the risk of lung cancer and makes you 3.5 times more likely to get ischemic heart disease, which is the #1 killer in the United States of America. The study also found that although there are real neurological reasons why people with ACE scores are more likely to engage in high-risk behavior, even if you don't engage in high-risk behavior, you're still likely to develop heart disease or cancer. To sum up, childhood adversity can triple your lifetime risk of heart disease and lung cancer, create a 20-year difference in your overall life expectancy, can literally get under your skin and change your physiology and the way your DNA is read and transcribed, and yet, doctors have no training on how to spot, stop, or treat it. Dr. Robert Block, a pediatrician, once said, "Adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today." People are out there every day, dying of heartbreak. The trauma I experienced at the hands of my parents and various other family members is still within me. It made a home for itself inside my body, so it's no wonder to me anymore that even though I did the absolute best I could with my diet and have a better than average BMI, I still wound up with an overall cholesterol that was a little too high. The stress I endured is lingering and continuing to hinder my health long after it was put there. So what do we do now? I believe the first step I wound up doing by accident in the process of doing research for this video. I discovered that 67% of the US population had at least one ACE. 12.6, 1 in 8 of us, have 4 or more ACEs. It's shocking, but at least somewhat comforting to know how common what I went through is. I found video after video after video after video of people talking about their own trauma and what they've done with it. The research I've done for this project has helped me better understand what's going on with my body and what's going on with my mind. And now I can hold on to that knowledge of myself. It helped me realize that this isn't a me problem, this is an us problem. The scale of this public health crisis shows that there needs to be a movement of awareness before anything else can change. The solution will be helped by doctors with home visits, care coordination, mental health care, nutrition, and medication. But most of all, I believe that education of parents and parents-to-be will be the most effective. Psychiatrist Bessel von Vanderkolk said, "The parent-child connection is the most powerful mental health intervention known to mankind." If you're the adult survivor of childhood abuse or neglect, please seek out help from a professional mental health practitioner, and do your best to talk about your experiences with others. According to Dr. Karen Treisman, relational trauma requires relational repair. As for the people listening who have little to no ACEs, it's important to remember that those of us with more have had a very different experience from yours growing up. The best advice I can give you is to be patient and understanding with us. If someone feels comfortable enough to tell you that they've had to cut certain family members out of their life for the sake of their own mental health, please do not tell them that they have to be in contact with their abusers. That only creates unneeded feelings of shame, doubt, and guilt in the adult victim. Separating ourselves from our earliest support system may seem like we're going against our nature, but it's only because the tiger who raised us went against their own nature first. We are simply obeying the other part of evolution, self-preservation. Thank you.